صباح الخير طلاب. اليوم راح نكمل محاضرة Principle of Antimicrobial. اوكي. اللي هي تابعة لنفس المحاضرة الأولى اللي أخذناها Principle of Antimicrobial Infections. Today we are talking about agents used in bacterial infection. Agents used in bacterial infections. Actually, this agent used in bacterial infection organized into 6 families. حوالي 6 عوائل من هذه الدراجز التي تستخدم for bacterial infection. منو هذه العوائل أو الفاميليز؟ بنسلينز، سيفالوسبورينز، تتراسايكلين، aminoglycoside, macrolides, fluoroquinine. Actually, plus a group labeled other, راح تشوفها بالكتاب مكتوب عليه other, that is used to represent any drug not included in one of other 6 group drug family. يعني this is the 6 family are used as agent antibacterial drugs. In other to others, they called other on them, not belong to these 6 group. Chemotherapeutic spectrum. Actually, this agent or this antibacterial agent divided into 3 kinds or 3 types of which is called narrow spectrum antibiotic, extended spectrum antibiotic, and combination or a broad spectrum antibiotic. For narrow spectrum antibiotic, chemotherapeutic agent acting only on a single or a limited group of microorganisms are said to have narrow spectrum. If it is act only against a single or limited group of microorganisms, they say to have narrow spectrum. For example, isoniazid is active only against myobacteria. لذلك isoniazid we can call it narrow spectrum antibiotic. Why? Because it's just against single microorganisms such as myobacteria. Extended spectrum antibiotic is the term applied to antibiotics that are effective against gram-positive organisms and also against a significant number of gram-negative, يعني against gram-negative and gram-positive. Example, ampicillin. Ampicillin is considered to have an extended spectrum because it acts against gram-positive and some and some gram-negative bacteria. In this case, we can consider ampicillin as extended spectrum antibiotic. A broad spectrum antibiotic, for example, of tetracycline, chloramphenicol. Why we call the broad spectrum? Because they affect a wide variety of microbial species and are referred to as broad spectrum antibiotic. Okay, we're talking about that. Combination of antimicrobial drugs. It is therapeutically advisable to treat patients with a single agent that is most specific to the infecting organism. Yeah, which is useful or advisable single agent. It's not advisable to use more than one agent. Why? Because this strategy reduces the possibility of superinfection or decrease the emergence of resistant organism and minimize toxicity. يعني this for 3 reasons why it is advisable to treat patient with a single agent to the infecting organism حتى نقلل toxicity نستبعد أو نقلل حصول الريسيستنس المقاومة الأورجانيزم للدراجز وأيضا حتى ما تصير مضاعفات أخرى أو super infections. However, situation in which combination of a drug are employed do exist. For example, the treatment of tuberculosis benefit from a drug combination. In some cases, in some infections, we need to use more than one antibiotic. For example, in case of tuberculosis, here there is a combinations, but المفروض أو it's advisable to use single agent. Why? To reduce toxicity, resistant organism, super infection, حتى نبتعد عن overcome these aspects. There is an advantage and disadvantage of drug combination. يعني هناك أكو فوائد وأكو مضار من الدرج combination إذا استخدمنا أكثر من drugs. Okay. What is the advantage of a drug combination? Certain combination of antibiotics such as, for example, beta-lactams and aminoglycoside راح نتحدث إن شاء الله في المحاضرات القادمة the next lectures about beta-lactams. Yes, certain combination of antibiotics such as beta-lactam and aminoglycoside show synergism. That is, the combination is more effective than either of the drug used separately. شنو يعني synergism؟ يعني شلون نقول قوة؟ يعني هذا الكومبينيشن أعطى قوة، أعطى قوة بالتأثير. Show synergism. That is, the combination is more effective than either of the drug used separately, because such synergism among antimicrobial agents is rare. Multiple drug use in combination are only indicated in a special situation, for example, when an infection is of unknown origin. في حالة الأنتيبيوتيك حقيقة السينرجيزم أو يعني إحنا بنسوي combination of two agents، هنا السينرجيزم يكون نادرا ما يحدث، لأن هنا ممكن يصير عندنا drug interactions أو يصير عندنا مضاعفات أو يصير عندنا مقاومة، فقليل من الحالات نستخدم عندها more than antibiotic. أوكي، مثل ما قلنا مثال على ذلك تبركلوز. لكن يفيد another drugs for example مثلا عندنا الانالجيسيك ان شاء الله ناخذه بعدين. for example analgesic drugs هنا ممكن نستخدم two combination of drugs. اولا راح نقلل التوكسيسيتي هنا، بالعكس يعني انا حتى اقلل الدوز مال for strong analgesic اعطي دوز اقل واعطي another analgesic drugs هو mild حتى يصير هنا more synergism effect. لكن بحالة الانتيبيوتيك لا، هو rare يصير عندنا synergism effect، لكن in some situation actually we need that, but it's advisable to use a single agent of antibiotic. Okay. Disadvantage of drug combinations. Disadvantage: a number of antibiotics act only when organisms are multiplying. Thus, co-administration of an agent that causes bacteriostasis plus a second agent that is bactericidal may result in the first drug interfering with the action of the second. يعني ال disadvantage حقيقة مالت drug combination في حالة antibacterial agent. احنا طبعا نلاحظ ان الانتيبيوتيك when it's act لما يكون الاورجانيزم are multiplying ف thus الكو-administration for example عندنا مثلا نعطي bacteriostasis وبلس bactericidal ممكن result in the first drug interfering يصير interfering with one drug with the action of the second drug. Example: bacteriostatics tetracycline may interfere with the bactericidal effect of penicillin and cephalosporin as an example of the disadvantage of drug combination. Now we are talking about drug resistance. Drug resistance مقاومة الدرج اللي هو الانتيبيوتيك. ممكن بعض البكتيريا المايكروorganism agent can resist this drug. How? In which mechanism? Actually, it is by two ways, and each way have subdivided into another. Firstly, genetic alteration leading to drug resistance. ممكن تصير تغيرات جينية genetic alteration leading to drug resistance, or altered expression of protein in the drug resistant organism. ممكن يصير تغير البروتين بهذا الأورجانيزم فيصير مقاوم، أو تغيرات جينية genetic alteration leading to drug resistance. For genetic alteration leading to drug resistance, such as resistance developed due to ability, and actually I summarize this into a few lines. Resistance developed due to the ability of DNA to undergo spontaneous mutation or to move from one organism to other. يعني هذا ال DNA ممكن يعاني طفرات أو ينتقل من organism to another. بهذه الحالة هنا نطلق عليه أو يسبب لنا genetic alteration which is lead to drug resistance. This is can be subdivided into two kinds, which is spontaneous mutation of DNA or DNA transfer of drug resistance. For spontaneous mutation for DNA هنا شنو يعني spontaneous mutation يعني طفرة تلقائية بالدي ان اي. نعرف الكروموسوم chromosomal alteration may occur by insertion or deletion or substitution of one or more nucleotide within the genome. هذا مثل maybe you study this in biology. الكروموسومات التغيرات الكروموسومية اللي ممكن أن تحدث نتيجة insertion أو deletion أو substitution of one or more nucleotide تغيير النيوكليوتايد within the genome. الريزلت هنا شنو يعني the resulting mutation may persist تصير طفرة ممكن may persist be corrected by the organism or be lethal to the cell. يعني ممكن أن هذه الميوتيشن اللي حدثت عن طريق التغيرات اوكي اللي صارت بالكروموسوم ممكن يصير ميوتيشن ممكن انها تصحح corrected by the organism نفسه يصححها او ممكن تكون lethal to the cell قاتل للخلية. if the cell surface اذا هاي الخلية عاشت ما ماتت it can replicate راح تتكاثر and transmit its mutated properties to progeny cells. فممكن راح تنقل هذا الميوتيشن الى البروجيني سيلز مالتها. اوكي فهنا هذا نسميه spontaneous mutation. هذا نسميه spontaneous mutation. Some spontaneous mutation have little or no effect on the susceptibility of the organism to antimicrobial agent. However, mutation that produce antibiotic resistance strain can result in organisms that may proliferate under certain selective regime. As an example, is the emergence of rifampin resistance mycobacterium tuberculosis when rifampin is used as a single antibiotic. As an example for spontaneous mutation. يعني what is important of this how spontaneous mutation occur in a summary way chromosomal alteration. What's the result of this? Result of mutation. This mutation could be corrected or could be lethal to the cell. If the cell survive, this mutation can be converted to the progeny cell. As an example, اللي هو rifampin resistance mycobacterium tuberculosis. When rifampin is used as a single antibiotic, that's why here tuberculosis بحالة التوبركلوسيس نستخدم combination of drug حتى هسه عندنا resistant just بحالة التوبركلوسيس. DNA transfer of drug resistance اللي هي الحالة الثانية اللي هي تابعة للgenetic alteration in addition to spontaneous mutation اللي هي DNA transfer of drug resistance. Resistance acquired due to DNA transfer from one bacterium to another. راح يصير انتقال DNA من بكتيريا إلى بكتيريا أخرى. ينتج عنها resistance properties are usually encoded in extra chromosomal R factor known as resistance plasmid. Plasmid may enter cells by process such as transduction أو نسميها mediated transformation or bacterial conjugation. Actually, I summarized this in your book. They somewhat بعض الشيء هم they explain DNA transfer in details, but I try to summarize it for you. Just we need to know in the DNA transfer drug resistance acquired due to DNA transfer from one bacteria to another. اوكي، ودائما يكون encoded by extra chromosomal R factor اللي هو resistance plasmid، عبارة عن plasmid. Just you need to know that. The other way for drug resistance, which is called altered expression of a protein in a drug-resistant organism. Altered expression of a protein in a drug-resistant organism. تحت هذا العنوان راح تكون عندنا 3 فقرات اللي هي التغيرات اللي تصير بالبروتين in a drug-resistant organism. ممكن يكون عندنا أول شيء اللي هي modification of target site أو decrease accumulation أو enzymatic inactivation، وراح نروح لكل نقطة ونشرحها باختصار ونفهمها. إذا altered expression of a protein in drug-resistant organism. Drug resistance may be mediated by a variety of mechanisms, such as lack of or an alteration in an antibiotic target site, lowered ability of the drug due to decreased permeability, the increase the efflux of the drug, or presence of antibiotic inactivating enzyme. يعني ممكن هذه هسه راح نشرحها بالتفصيل. شنو يعني what is the meaning of modification of target site? Alteration of an antibiotic's target site through mutation can confer organizable resistance to one or more related antibiotic. يعني ممكن one or more related antibiotic. As example, Streptococcus pneumonia resistance to beta-lactam antibiotic involve alteration in one or more of the major bacterial penicillin binding protein, resulting in decreased binding of the antibiotic to its target. راح يقل ارتباط الانتيبيوتيك بالهدف مالته اللي هو الاورجانيزم، اللي هو المايكرو اورجانيزم او البكتيريا اللي ممكن تريد تشتغل عليها، فيقل ارتباطه بها حتى يقاومها او يقضي عليها. هذا نسميه modification of target site. عندنا بعد decrease accumulation اللي هو decrease الuptake or increase efflux of an antibiotic can confer resistance because the drug is unable to attain access to the site of its action in sufficient concentration to injure or kill the organism. يعني ما راح يدخل بالتراكيز اللي نريدها حتى يقتل أو ينجر الأورجانيزم. Example عليه gram-negative organism can limit the penetration of certain agent, including beta-lactam antibiotic, tetracycline, chronomphenicol, as a result of an alteration in the number and structure of protein فيها channels in the outer membrane. يعني راح يصير هنا فلذلك راح يصير عندنا decrease accumulation. ليش؟ لأن بعض المايكرو أورجانيزم example عليها مثلا gram-negative organism يقل اختراق الانتيبيوتيك لجدار الخليه، يعني راح يصير تغيرات بالستركتشر اوف بورين اللي هي الحفر او الثقوب او الشانلز اللي تدخل من عندها. اوكي، فهنا ما يصير عندنا الاكيوميليشن اللي احنا نريده حتى يقتل او انجر او كيل الاورجانيزم. ومثال عليه قلنا الجرام نيجاتيف اورجانيزم هي راح تكون مقاومه للبيتا لاكتام انتيبيوتيك تتراسايكلين اند الكلورام فينيكول، including البيتا لاكتام والتتراسايكلين اند الكلورام فينيكول. enzymatic inactivation اللي هو ثالث حاله تابعه للaltered expression of protein in drug resistant organism. The ability to destroy or inactivate the antimicrobial agent can also confer resistance on microorganisms. Example of antibiotic inactivating enzyme include beta-lactamases اللي هو benzylinases. هذا الانزيم that hydrolytically inactivate the beta-lactam ring of penicillin, cephalosporin and related drugs راح نتكلم عن البنسلين والسيفالوسبورين إن شاء الله بالمحاضرات القادمة. Another enzyme هو acetyl transferase that transfer an acetyl group to the antibiotic inactivating chloramphenicol or an aminoglycoside. Esterases that hydrolyze the lactone ring of microleads. إذا for example عندنا بعض الإنزيمات اللي هي بتكون enzymatic سبب enzymatic inactivation فتصير القابلية الability to destroy or inactivate an antimicrobial agent can confer resistance on microorganism due to these three enzymes. Complication of antibiotic therapy because the mechanism of action of a particular antibiotic is selectively toxic to an invading organism. It does not protect the host against adverse effect. ما نقدر نحمي المضيف من adverse effect. For example, the drug may produce an allergic response or be toxic in ways unrelated to the drug's antimicrobial activity. يعني الكومبليكيشن اللي ممكن تحدث due to antibiotic therapy ممكن تصير harm to the host. الادفيرس افكت طبعا اللي هي ممكن اكيد راح نلاحظها for each drugs ممكن يحدث عندنا allergic response or toxic effect. One of them it is hypersensitivity. One of this complication of antibiotic therapy it is hypersensitivity. Hypersensitivity reaction to antimicrobial drugs or their metabolic product frequently occur. For example, والشائع والمعروف اللي هو البنسلين. Despite their almost absolute selective microbial toxicity can cause serious hypersensitivity problem. Ranging from ممكن من urticaria ممكن حكة بسيطة to anaphylactic shock. If a patient has a documented history of, for example, Stevens-Jones syndrome or toxic epidermal necrolysis reaction to an antibiotic, it should never be re-challenged, not even for antibiotic desensitization. Actually, hypersensitivity or hypersensitivity reaction test, it should be done before the patient administered or especially have an injection of antibacterial injections, especially for children. So the doctors need to know the patient history before he prescribes the penicillins for him. In all others country, they make hypersensitivity reaction test for penicillin, very small dose, low dose. If there is any reaction or anaphylactic reaction, they will not give him penicillin injections. Direct toxicity اللي هو أيضا as complication of antibiotic therapy, high serum level of serum antibiotic may cause toxicity by directly affecting cellular process in the host. Example, aminoglycoside can cause autotoxicity. Aminoglycoside as an adverse effect of aminoglycoside, a common adverse effect هو autotoxicity. Also as a combination of antibiotic therapy اللي هو super infection. The drug therapy particularly with a broad spectrum antimicrobial or combination of agent can lead to alteration of the normal microbial flora of the upper respiratory, intestinal, and genitourinary tract, permitting the overgrowth of our opportunistic organisms, especially fungi or resistant bacteria. These infections are often difficult to treat. For prophylactic antibiotic, certain clinical situations require the use of antibiotic for the prevention rather than the treatment of infection. يعني as for prophylactic antibiotic يعني شنو prophylactic antibiotic يعني الوقاية. فبعض certain clinical situation بعض الحالات require the use of antibiotic for the prevention rather than the treatment of infection. مثل عندنا some clinical situation in which prophylactic antibiotic are indicated. For example, عندنا pre-treatment may prevent streptococcal infection in patients with history of rheumatoid heart disease. Pre-treatment of patients undergoing dental extraction. Pre-treatment may prevent tuberculosis or meningitis among individuals who are in close contact with infected patients. A treatment prior to most surgical procedure can decrease the incidence of infection. And also pre-treatment with zidovudine protect the fetus in case of HIV infected human infectious virus in a pregnant woman. That is our lectures for today. Thank you for listening, and I'm happy to answer any questions you have, and you can send me any questions by Google Classroom. Thank you for all.